If you have a dog or a cat, your vet has probably talked to you about heartworms. The parasites can cause your pet all sorts of problems, and the thing is, they can be easily prevented. Dr. Rebekah Hartfield is a veterinarian in Holdenville, and she joins us this morning to talk about heartworms. Good morning to you and to Sally.
Good morning. We are so happy to be here today.
There's something about our pets. I mean, they are truly part of our lives, part of our family, aren't they?
Yes, they are, for sure.
So it's really important to take care of their health in all aspects.
Yes, ma'am. And I'm all about prevention.
And that's what we're going to talk about today. Okay, so heartworms. Most people have probably heard of them. Tell us, how does your pet get heartworms?
So your pet can get heartworms from a little bitty mosquito. That mosquito can bite a dog that already has heartworms. That larva develops in the mosquito and can bite your dog. If your dog isn't on prevention, that little mosquito passes on that larva, and it then can turn into an adult heartworm. From there, those adult heartworms breed, have microfilaria. Basically, baby heartworms is what I explain to owners. And those are what develops in the heart and can get into the bloodstream, and that's when it can get really serious.
So I want to give a word of warning. I want to show a picture because I just don't think people realize how disgusting and really how dangerous they are. So these are the heartworms after they have been removed from the heart.
Correct.
Now talk a little bit about, because once you get heartworms, once they get the heartworms, can your dog be treated?
So they definitely can be treated. It's really important that your pet stay on prevention during the first 1 to 2 months that they get infected, get bitten by a mosquito. At that point, we can still prevent. But after that point, then they turn into adult heartworms, and that's when it becomes way more complicated. They have to go through a series of treatments with an injection of imidacide, and this is a big injection that goes in their back. And it takes at least 6 months for them to clear those adult heartworms. In the meantime, those heartworms can cause some pretty significant damage in the heart. And so that's why we want to stress prevention rather than treatment.
Before we get to the prevention, tell me about the symptoms. How would you know if your pet had heartworms?
Exactly. So coughing is probably the most, the biggest clinical sign that I see. Clients come in and say, my dog's been coughing for a while. No, they're not on prevention. First thing I'm going to do almost all the time is a heartworm test. And so coughing, lethargy, just not doing well, those are the big symptoms that I see.
Are they more prone to younger pets or older pets, or just any pet that comes in contact with one of those mosquitoes?
Any pet. So most of the younger dogs, especially puppies that are coming in for their initial puppy visit, anything before they're 6 months of age, those are the ones that we're going to be putting on prevention early. And then as long as they stay on prevention, it is very rare that a dog can develop heartworms. But I do see them from 6 months on. It doesn't matter the age. And here in Holdenville, just this week, I diagnosed 2 dogs with heartworms and did 2 dog treatments this week as well. And that's about average per week for me here. So it's definitely a big deal.
Very common. Okay, we've got a little bit of video here. This is actually one of the dogs I think that you said came in and needed to be treated. This medication, this injection, basically you'll shave the little side where you're going to give the shot?
Correct. So we'll surgically prep that site. We will pre-prep them with some pain medication and then inject them in their back muscles with that medication. They'll stay with us for the day. They go home, usually with what the Heartworm Society recommends, and that's the protocol that I follow here. They'll come back in 30 days and they'll get the same treatment 24 hours apart. And then we test them in 6 months, and usually they're negative at that point. But it's really important that entire time to keep them on a preventative.
Sure. All right, real quick, I want to wrap up, but we not talk about prevention because you've got lots of options.
Yes. So there are so many options, and you need to discuss these options with your veterinarian. Some of my favorites are NexGard Plus, and I also really like HeartGard. And Simparica Trio is also another great product. All of these are products I have at my clinic, but there are many others. But it's so important to meet with your veterinarian, for that annual wellness heartworm test and get your dog on prevention.
And most of those are just pills that you give your dog once a month?
Yes, so those are chewies that they can give. There's also an injectable form that many vets also carry as well.
Very good. All right, and I want to remind you, you can check Dr. Hartfield's website. It's drhartfield.com. You can also follow her on social media. She does some really amazing stuff on there, and we appreciate you joining us this morning. And thanks to Sally,
Thank
too.
you.